My name is Faisal Khawaja. I'm a pharmacist and the operations manager at Marchese Healthcare. I'm also the lead naloxone trainer. I've definitely seen people with conditions like diabetes or cancer are definitely treated differently than people who have mental health disorders. And substance use disorder being in the spectrum of mental health, there is definitely a stigma attached to mental health disorders on the part of healthcare providers. We have this paternalistic approach where we think, like we would treat our children, we teach them. You've been given the information, you've been given the knowledge by me, or by other people, or by your teachers, or by society. You should know better. There's obviously still work to be done even amongst the people who should know. One of those kinds of things that you can do is to learn about naloxone and get trained on naloxone and be prepared with naloxone in the event that you're in a position to help somebody with an opioid overdose. It's really not that difficult to see the impact of stigma on people's lives in many different areas. You only have to walk around or drive around the city and see how people who are perhaps homeless or otherwise affected by various economic challenges, how they're treated by different people on the street or in their cars or what have you. Some people have a tendency to lead with compassion, and they'll reach out, they'll talk to these individuals and engage with them with an understanding that their essential humanity is the same as their own. Other people, not so much. So if people have the idea that it is a street person that uses heroin and they've sort of brought this upon themselves based on the poor decisions that they've made, that's completely wrong. Anyone from any walk of life, any socioeconomic stratus can be affected and is affected by substance use disorder and right now opioids being a particularly serious crisis. So I want people to understand that. It could be someone that you know, someone that you work with, someone that you love that has the potential to be affected by this. So if you bear that stigma, it's going to be really difficult for you. If you have that mindset, it's going to be really difficult for you to relate to that person and to help that person that you love potentially to work out a way to address, to ameliorate, to make better, to get past this particular problem that they're having. So if you really care about the people that are around you, then you should care about this issue. If you have a connection, if you have a child, you understand that you would do anything for them and that they are the most important thing in your life. You understand in that moment that you would not hold something back from them or deprive them of something that potentially could help them or save their life, and the judgment goes away. And it's probably the most powerful way to address this problem is to meet people with lived experience, to talk to people with lived experience. Harm reduction for me is so critical because it tells us that there's hope. We believe every individual has a future. And if we believe that every individual has a future, then we have to start by making sure that they're around to see that future.